Hi, I'm Gina, the Laser Vision Director at Tidewater Eye Centers. I'm here with Dr. Edmonds, and I'm going to be asking him a few frequently asked questions submitted by you. Of course, we'll answer these more thoroughly at your free consultation, but here's a few answers for you now. I've read about hydration making a difference with the outcome. Is that still true with the current procedures?
It's really critical. Almost everyone has dryness after the procedure. It usually lasts for a couple of weeks. Some people can last for several months. We can usually find those people or figure out which ones are going to have problems, and those patients will pre-treat with either artificial tears or a prescription drop called Restasis or something called punctal plugs. And when we do that, we reduce the time period when they have dry eyes and blurred vision after surgery.
Is it possible to still wear contacts after surgery?
Yes, it is possible to wear contact lenses after either PRK or LASIK surgery. Luckily, that is seldom, if ever, needed. But if you did have to wear contacts, you could.
With LASIK, if a touch-up is required, do they have to recreate the flap or can they lift the current one?
Well, one of the great things about LASIK surgery is you can fine-tune it and you can adjust the result at a later point. Very rarely is it needed. 96% or so of our patients never need any touch-ups, but of those that do, we can either, with LASIK surgery, we can either lift the existing flap or we can treat on the surface based on how long it's been since their surgery.
What's the difference between recovery for LASIK and PRK?
Well, both procedures offer an excellent recovery, and the vision is identical at about 1 month after surgery. With PRK, in general, patients have to wait a week or so for their best vision to come back, whereas with LASIK surgery, usually they see better the next day. There is some people do choose PRK over LASIK, mainly because they perceive it as being a safer procedure because there's no flap, and they're willing to give up a week of recovery period for it. But both procedures offer great success rate at a month.
Do you know of any patients whose flap came detached, and if so, what were they doing?
I've not personally had that happen, but it's certainly been reported. More likely than that is to have the flap just shift slightly to the side with trauma in the early post-operative phase, meaning the first day or two after surgery. And that's usually not a big deal. The great thing about LASIK is we can go back and refloat the flap into perfect position and the eyes recover beautifully if it's caught quickly.
Thanks, Dr. Edmonds. So, now that you're ready to come on in for your free consult, I'd just like to give you a little bit more peace of mind. We do have 24 months, no interest financing, and special discounts available. And if you want to share that discount with a friend, we'll offer you both 20% off if you have surgery on the same day.